Hi everyone, welcome back. This is our last video for the ethics section. The next section is professional responsibilities, very similar to ethics. It's both professionalism and ethics topics that fall in both. I won't be following a strict template like I was for this. I was going over the ethics codes exactly for you in these sections, but more talk about it generally and provide more examples. But it is your last large module of the entire course. So we're really close to the end. Congratulations and good job for making it this way. It's been pretty painless. This section we're going to talk, this is the BACB ethics code, and it's their responsibility to supervisees and trainees. A tech would be a supervisee, and a trainee would be someone who's accruing hours to become a BCBA. So, the process is similar for both, but you do talk about different things, and it does look a little different for both. So this is sort of their responsibility for both, all the things that overlap and the ethical responsibilities they have. Essentially, this is what they need to do for you. And I added this section so when supervision is not correct, like something's wrong with it, you're going to know because it's going to violate one of these ethical codes. And so I think that's important so that you can advocate for yourself to get really good supervision, which, especially when you're new to the field, you're going to need. Okay, so their first thing is they have to comply with supervision requirements. They're different for behavior techs and trainees, individuals who are training to become a BCBA. They need to be knowledgeable about the supervision requirements. The BACB dictates it. But also licensure, there might be licensure requirements, which would be state by state. Funders sometimes have supervision requirements and other organizations might, but they need to know all of those and be following all of them, all the policies and regulations. Behavior analysts use video conferencing to conduct remote supervision with compliance with BACB and state regulations. A lot of that is HIPAA compliant or FERPA compliant. There are states that don't allow that. So if you're in one of those states, then you can't do remote supervision. Follow all applicable requirements. Behavior analysts ensure supervision practices adhere to all the requirements. It's both of your responsibility to do that, but especially when you're new, they need to guide you with that. But all of these supervision requirements are written in our documentation as far as the BACB goes. You should be able to find the other ones as well. And you should have a conversation with your supervisor prior to starting supervision about what the requirements are and how are we going to meet them. So they're written down and we know we're following the most restrictive. If licensure says you need more supervision, you follow that because it will automatically fit in with the other ones, and same with funders. Supervision competency. So they need to supervise within their scope. So they can't supervise outside their expertise or competence. If they've never worked with adult populations, they can't supervise someone with adult populations. They also need to continually develop their supervision skills. Supervision is a skill set in itself, and we all start maybe not great at it. We get better over time, but to go from the beginning to getting better, you need to develop it. They take continuing education on supervision, which helps, but they also need to, it's funny, like you wouldn't say like they need a supervisor to supervise their supervision. Like we're getting into a weird meta world with those terms, but they would need a supervision mentor. And like there's no requirement like you have to meet with them that much, but they need someone who supervised a lot to kind of help them through all. You can ask, how many have you supervised? How long have you been supervising? Ask those questions. And if they're relatively new to it, ask if they have someone who can help them with it, like help mentor them through supervision. I think that's completely appropriate. And then review best practices before taking on a trainee. BCBA reviews evidence-based supervision methods. We have evidence-based supervision methods and how we're ways that we've seen in research to be really effective for supervision. So they need to be up to date on that information. Volume. This is hard. So it's high quality supervision, and you need to limit the amount of trainees or supervisees you take on. It depends on the person here. Like, I tend to be able to and what else they're doing. So there's a long time where I only supervised, and I could take on quite a few because that was my only job. But if they're doing a ton of other things on top of the supervision, it might be a much smaller number. It is gonna be based on person by person. If they decline a new request due to already supervising some amount, they need to document that. That's important with the company. If they're asking them to take on more RBTs, more clients, the company should have a process for declining and saying you're at your capacity. Accountability and supervision. So they're responsible for their own supervision practices. Like being a BCBA or being a supervisor, you can be an independent contractor, solely responsible for your own work. You need to know that as their supervisee. Are you employed with the company or are you an independent contractor? And realize if they're an independent contractor, if you go to your boss, like whoever owns the company or the clinical director, and you say this isn't working, they can probably adjust things for you. It's a different situation than when they're actually an employee. BCBAs must address any inaccuracies in the notes, cross it out, write what really happened, especially in terms of supervision. They need to ask you for feedback on their supervision. So they need to be asking you like, what am I doing well? What can I improve? Do you have any suggestions for improvement? Rate my supervision. How am I doing? They need to ask for review and feedback from you on supervision. You need to maintain supervision documentation. They also need to maintain it. If everyone maintains it and is careful, we'll never lose anything. We should have different levels of documentation and maintaining, so there's at least one copy somewhere. They need to ensure everything's completed and error-free and keep it in confidential record keeping. It's best if you do that as well, so it's your information to do with as you want. But they must treat it like a client's information. It must be in a locked cabinet in a locked room when they store the documentation. If you're writing client names into your supervision documentation, you also have to treat it like confidential material. We're maintaining and holding on to everything for 7 years. So once 7 years has passed, you can destroy the material that's 7 years old. And also know no one's going to have documentation of what you did 7 years past. If you want it longer, you should keep it longer. I've never heard of a situation where someone might need it, but some people prefer to be safer than others with documentation. Providing supervision and training, we're doing evidence-based supervision. So we're utilizing supervision techniques that are based in research, empirical research, and they will know what that is. That you don't, though, if you're going to go on and get more credentialing and whatnot, you should start diving into that information. But if you're focused on being a behavior tech right now, ask them what they're going to use. It should be tailored to your needs. Preferences are how you prefer to learn, your cultural identity, any kind of protected identities that you may be a part of. Reinforcement focus, it should be positive. So we're using positive reinforcement strategies. We don't use kind of reductive approaches for supervision. It's always positive. Antecedent techniques are great. Same thing, differential reinforcement and antecedent techniques. We're also going to use something called behavioral skill training. It's a 4-step process to teach a new skill. First, you inform the person why the skill is important and what it is. Then you model the skill for the person. Then you have the person role play the skill, and then you give them feedback. This will help them develop skills. BST is considered empirically grounded. It's a great technique. If they're using nothing but BST, that is fine. We have lots of research to say that BST really helps or is a great technique to use with supervision. Incorporating and addressing diversity. So you're going to incorporate and address diversity within the supervision process. Be open to discussions on implicit bias. They need to be open to having discussions about implicit bias. They might be doing it on their own time, so that they can understand their biases and see how it impacts their professional decision making. They need to engage in training modules on cultural responsiveness. They need to do that for their supervisees, but also their clients and learners, just like you're doing it as well. Incorporate models that help enhance cultural awareness and sensitivity. They need to provide you with modules on cultural responsibility. That might look like, having you read articles, having you read books, go to different events. It could be lots of different things, but they need to be helping you improve your own cultural responsiveness. And then they need to address with you diversity-related topics. So you need to integrate that into supervision and training. So they have to not only respect your identities, culture, and whatnot, but they also need to help you improve your cultural responsiveness with other identities and cultures. So progress monitoring and feedback. They need to provide some sort of structured evaluation for you. So it might be checklist, some sort of skill performance that they do with you. They should go over that with you so that you fully understand your strengths and weaknesses. They need database feedback. So we're not just saying great job. We're saying you did great. You delivered that prompt at this time, which is what we discussed. And they need to develop written improvement plans for you if there's a problem, or just we all need to improve. So there should always be improvement or goal plans for supervisees. The whole goal is to provide constructive feedback that helps trainees improve and develop their skills. And so it's all based in data, like things that were observed, that you did, that they talked to you about, not just, you don't do DTT well, it just doesn't look right. Like, what exactly doesn't look like? What did you observe that I did wrong? And they need to provide you with all that information. Okay. So if they're going to give you a task, they're gonna only give it to you if you're competent in the task, and the trainee needs to perform it several times before they can do it independently. So this is all building your competence and providing you with training. And delegation only occurs after the supervisee has provided their ability to handle the assigned task. And if you say, I can't handle it, we need to go back and maybe look at more training, look at something else to help you with it. Nobody should be giving you any tasks that you're uncomfortable with because you're just not competent or ready for those tasks. And they know that, and that's part of their ethical responsibility to you. Evaluating the effects of supervision and training. Okay, so there's a couple ways we're going to do this. One is they're going to look at client data and analyze and look at the client outcomes and decide if they're effective and if you're effective. So they're effective supervising you, and are you effective deliver services? They're going to revise supervision frequency and format based on that, how the client's doing. And they're going to continuously evaluate and refine supervision to optimize the learner's outcomes. And there's two other ways we evaluate the effects of supervision. Client learners and feedback from you is one. So they need to ask you for specific feedbacks on the effects of supervision and training, and then evaluating you like apart from just client data. It's also evaluating that you're improving your skill set. So it's like a 3-pronged process, I think of. Learner outcomes are one, your evaluation of their supervision, and then your skill set, like them evaluating your skills. So facilitating continuity of supervision. Just like you have to be careful about continuity of services for clients and learners, they need to be careful with continuity of supervision. CBAs plan ahead to minimize disruptions in the supervision continuity. So like people getting sick, illnesses, events, overworked, all those things, we need to try to minimize them and plan for them as much as possible. But like the big one here, like I get a lot, is maternity, right? That we can really plan for that. We know the baby's coming, or the person who's having the baby knows. So we need a plan for that. Whether your supervisor's having the baby, taking maternity, whether you're having the baby and taking maternity, we got to make a plan. There are health things that we can't plan for. They just happen, and those would be harder, but we do our best to minimize it. But anything we can plan for, we do. Before like a vacation or a maternity or whatnot, they need to arrange for a temporal placement of your supervision. They have to let you know the arrangement as soon as possible if something's changing, if they're finding a temporary replacement for you. Okay, they also really need to appropriately terminate supervision. So you have to document the plan to reduce the negative impact. So we need a plan to end the supervision. So a BCBA is required to give 30 days notice when leaving an agency. So that's where this commonly happens. They leave, right? And then you don't have a supervisor. The agency usually will plan for this, but they need to give adequate notice so that the agency can help you plan for it so you're not affected. And then collaborate with a transition plan. There needs to be a handover to this new person with some information about you and your preferences as far as supervision and the clients and what you're all working on. So there also needs to be a handover. So it's not just like my supervisor gone, new supervisor who doesn't know me. There should be a plan in place. The learner doesn't get affected as much. Okay. So their core responsibilities to you is follow the rules and requirements, the licensure, organization, funding policies, only supervise people within their area of competency, so provide supervision only in areas where they have expertise, limit the volume of supervisees and trainees to only what they can do effectively, only when they can provide high quality supervision, and they need to work that out with their agency. Be accountable for the supervisees' actions and training outcomes, take responsibility for performance and development, and maintain confidentiality in supervision documents, use evidence-based and individualized supervision strategies, tailored approaches to the unique needs of each of your supervisees, integrate diversity, cultural competency into supervision, recognize and adopt the cultural backgrounds of your supervisees, provide a structured feedback and performance monitoring, give clear, constructive, timely feedback to support growth, and delegate tasks only when competency is demonstrated. So don't give people stuff to do if they're not good at it or aren't ready to do it. And continually evaluate and adjust the practices so it's the best supervision methods, and ensure continuity during disruption. Maintain effective supervision even with changes. And then plan for termination and make sure there's a plan and a handover and everything goes smoothly.